Mark, we have just finished the first panel session at STEF 2024, which is actually going really well this year. I'm very excited. So what I found interesting about Paul Doonan's presentation of the survey results that the AI working group have done on the perception of AI in our workforce was the surprising amount of people who felt that there maybe wasn't a need or they were taking their own training. Tell us about what you're doing in Kent and Medway about that.
So thanks, Anna. That's a really interesting point, and I found that panel to be quite inspiring, quite honestly. So we had some industry leaders there alongside leaders in health and care, and of course we're working together. They gave us a really good overview, I think, of where we're going. So in Kent and Medway, we're looking at the implementation of artificial intelligence into clinical radiology. And of course, the nice thing about working across an integrated care system is you can much better coordinate what you're doing. So we have a single PACS network, for example, so we can take our AI radiology systems and implement them right across the patch. And then you've got your radiology teams, your other healthcare professionals, and of course, really importantly, those medical physics and clinical engineering colleagues who must be closely involved in that process for all of the reasons that the panel spoke about. So we thought about the medical physics experts. It's an important part of IRMA to make sure that we implement all of our imaging procedures safely. And that applies especially with AI, where it's not sometimes obvious what those systems are doing. Our physicists and engineers are very good at calibrating and understanding risk and making sure that those things are correctly implemented. So what I've done in Kent and Medway is to create a big group, if you like, of AI implementation group, and we make sure we have physics and engineering colleagues in there. And I think it's important also to mention computer scientists, scientific computing. Interesting on the panel that they thought that they hadn't got that engagement with scientific computing teams when they went into hospitals. They had a lot of integration with radiotherapy professionals, for example, where they looked at auto-contouring systems, but didn't have that engagement with scientific computing. So I think there's definitely an opportunity there because that group is really going to understand the system.
Can I ask you some other questions about the AI implementation group that you set up? So did you lead on that? Was that your suggestion, or did you work with other people at the ICB board level and discuss the need for this, really?
Yeah, so I have led on that, but my manager is the Chief Medical Officer.
Okay.
She said to me, Mark, I really want us to understand AI and clinical radiology better. Her vision, I think, is that at some point we will be able to do diagnoses on these systems much more efficiently. And so she asked me to set up that group. And I think it's also important to say that this isn't a standalone group. So we have an AI ethics group, you might call it. They're creating a system for implementation of AI in any forum. So it could be radiology, but any of our patient population data that we're looking at, they'll have a protocol that will sit right across the ICS that we can all plug into. And therefore, it's all about that collaborative process of working together to get the best outcomes.
And I'm just going to ask you about your relationship with the working relationship with the medical director, because I think that's probably quite unique to you, Mark. And how do you think we could encourage our medical physics and clinical engineering colleagues in the NHS to reach out to their ICB medical directors? Is there sort of a route that you could suggest, or what would you advise?
Yeah, thank you. I think it's a good question. So I think, I'm very lucky that I'm an integral part of that team, alongside other health and care professionals such as AHP and pharmacy colleagues, and we sit alongside the medics in delivering a lot of the programs. And I think the key for physics and engineering professionals and other scientific professionals is to really show what your expertise is, to come out of your rooms and your labs and tell people all about those unique skills that you have. And actually, sometimes it's just because there isn't a realization there of what those skills are. Your ability to calculate, your ability to calibrate, your ability to really put those safety elements into systems. That's right, is there. And that's so I think that's a big part of it.
Yeah, great. Okay.
And how about you, Anna? So we were talking when we came into the room about KaiTech and KCL, and so you've been having a grant and doing some work in AI implementation yourself.
Yeah, thanks for asking. So I had spent the previous 10 years at UCLH working on imaging biomarkers in MRI, actually, and I had a fellowship with NIHR. But I realised at the end of that fellowship that it wasn't just about the science and how clever your science can be, but very much about adoption and implementation, which led me on to looking at health technology assessment as a career. And the King's Technology Evaluation Centre, which is based at KCL, has been around for a couple of decades and have been working with NICE to look at their medical devices evaluation programs. And so within that, we cover lots of different medical devices, but the most recent project that we were funded to look into was the AI award, which was specifically around understanding the health economic implications about adopting and implementing AI. And so over the last 3 years, the team at KCL have worked closely with industry and clinicians and our healthcare science colleagues to understand what the clinical utility is of implementing these rather clever AI tools. And we did everything from AI-enabled reporting of ambulatory ECG all the way up to AI-enabled mammography reading for breast screening. And I think that what people don't realise possibly why it's taking as long as it is to adopt AI into healthcare and to benefit patients as quickly as possible is so much about the system in which we are placing the technology. And I think that, you know, the industry can only do so much. And as was alluded to in the panel, that each system is slightly different locally. But I think what's wonderful about the medical physics and clinical engineering workforce in hospitals is that we do all have our local practices. We share, but we also know we do things slightly differently in our own places. We also have that wonderful combination of technology knowledge and the numeracy that you alluded to, but also our training as clinical scientists is about understanding the clinical and the physiological and the anatomical deployment of all of this technology into healthcare service. And so what I would really like to do is encourage the MPC workforce to step up and step forward and do what you've done, Mark, which is put your hand up and say, I'm here, I can do this for you, I want to work with you. We don't need to do it in a combative way, we can do it in a collaborative way. In fact, what STEF is all about, which is beyond boundaries. And I think that that's going to be the answer when it comes to using AI ethically in a responsible and efficient patient benefit way.
So I think, Anna, what you're saying is you see physics and engineering professionals as a link between the companies that are producing these products, maybe our chief medical officers and the medical teams, in providing that conduit to make sure that things are done safely.
Yeah.
And how would people access KaiTech then, for example? So you've mentioned that around the country people are using different systems, they've got their local systems of work. How would they come to you to find out about the developments you've been making?
So first of all, we'll publish our reports with NHS England and they'll make them available on NHS England website. The other thing, of course, is I have to mention, of course, Professor Tyndale's discussion of the NIHR Health Tech Research Centres, of which there are 14, and Wendy is going to be leading on the network of those. So what I would say actually in the first instance is reach out to your local HRC and find out how you can contribute and vice versa into whatever AI technology that you're coming up against in your clinical service everyday job, because they will definitely be able to help you. Otherwise, Kitech, we have a webpage, kitech.co.uk, but we also are part of the Guy's and St Thomas's Cardiology and Respiratory NIHR HRC hub. So you can also contact us through that.
That's brilliant. And actually, to me, that's been a big part of the Steph journey so far. We're only at lunchtime on day one, and already we've seen these great talks, these big speakers, and learnt a lot, I think, about collaboration, but also the power that that collaboration gives you. I think Wendy gave some great examples this morning of how one person working alone will achieve so much, but working as a team with all of those multidisciplinary people is that much more powerful. Yeah. And Steph is a great place to do that, isn't it? Because if you think we've got lots of manufacturers here, we can go and visit all the new products. We've got someone coming tomorrow who's got a virtual reality AI teaching tool. We've got these great panel discussions, and actually, way beyond that, it's the ability to network with all of our colleagues. I'm sure all of us will go home with some new ideas that we've picked up over these days to take forward.
Yeah. Well, thanks, Mark, for having a chat with me. I'm excited to go and meet more colleagues and see what Steph brings us for the afternoon.
Great, thank you, Anna. I'm really enjoying it, and I look forward to the rest of the days.
Thank you.